The CDC predicts that the number of coronavirus cases, hospitalizations, and deaths will continue to drop over the next 4 weeks. The encouraging news comes with 10 states reporting they have already reached President Biden's goal of having 70% of adults at least partially vaccinated by July 4th. Dr. Bob Lahita is the director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health, and he joins us now to discuss this optimistic outlook. So, Doctor, it seems like we've reached a turning point in the pandemic, but is there a possibility of another surge or bump or something, considering, we are heading into a long weekend, and we have seen over the last year and a half or so that long weekends, celebration times, people gather, sometimes they let down their guard, and we get a bit of a bump in cases afterwards?
Yeah, I think, Anne-Marie, that there are two things that are important to understand. One is the number of people who are vaccinated, and secondly, the appearance of new variants. So, yes, I'm really encouraged by the fact that over 62% right now, today, at this time, have at least received one shot of the vaccine. That's really good news. And now we're dropping our masks and we're able to socialize fairly freely. But we still have to be cautious. And I think you're making that point, and that's a very, very important point to make, is that we can't be too safe. And if you feel like you're in a situation where you could be infected or that somebody has symptoms, definitely don a mask. Remember to keep socially distant and wash your hands.
The CDC often sort of gives these kind of blanket advice. But the truth of the matter with this virus is, it's different depending on where you are. So we talked about the number of states that have at least 70% of their adult population partially vaccinated, but there are states that are below that, the national average. Should people in those states be particularly cautious?
I think they should. We have areas of the country and we have demographics on certain populations of people, age groups like 18 to 29, where the vaccination rate is low. In Republican or red states, the vaccination is very, very low. And that's interesting. About 49% of Republicans seem to feel that they don't want to be vaccinated, or at least the numbers are low. In the Southwest and in the South, that has been the case. So, yeah, you have to be careful in those areas, but I wouldn't be extraordinarily careful because we're heading towards herd immunity, which, as you know, the president wants to achieve by July 4th. So I'm encouraged by that, and I don't want people to be afraid to socialize now without masks.
Does it look like we'll be able to achieve the president's goal?
It looks like we're going to get pretty close to that, as the numbers, as I mentioned, are 62% today. And that's really encouraging. I never thought we'd get there. There are about 14% of the American population that say, absolutely not, I don't want this vaccine no matter what. There are also people who can't get the vaccine, and we have to understand that they're out there, people with medical conditions, other convictions that prevent them from being vaccinated. So I think we're likely to reach herd immunity. There may be pockets within the country that are not very, very, how should we say it, safe, because the population there may not be totally vaccinated or may have low vaccination rates. But for the most part, I think we're headed there. Certainly by the end of the summer, Anne-Marie.
So that is good. That brings me to this other question, though. So the CDC has said, vaccinated Americans can take their masks off in kind of low-risk settings. But I'm wondering, do we have any evidence about whether or not people who are vaccinated can transmit the virus?
Yeah, that's a very tricky question. The vaccine, as you know, is designed to prevent at least one half of the vaccinated people from getting infected and from transmitting the virus. We look for something called correlates of infection, which predict how someone is protected. The data that we have suggests that about half of the Moderna and Pfizer people cannot, through their nasal passages or mouth, get infected. But we have seen that the virus may be present in pre and unsymptomatic people, such as the New York Yankees, and I think there's a Singapore airport population that was studied that were positive, but yet not transmitting the infections. They were pre or unsymptomatic infections, and that may be 3 to 20% or 3 to 20 times higher than we expect. So this is the reason we're saying that if you're around unvaccinated people, you should continue to wear your mask, or the unvaccinated person should wear their mask. Because the point that we don't know about is how able are we to transmit this virus if we are vaccinated, and may we be pre-infection asymptomatic, or may we just be infected, such as the New York Yankees, and be or asymptomatic totally, have no symptoms whatsoever, but able to transmit the disease. We simply don't know yet. So that's an area of study, and we call that the durability of the immune response, Anne-Marie.
So there has been some talk about whether or not we could possibly need booster shots in the future. I think you spoke to us about it, that, you know, we are still learning about the virus, and so we don't know if a booster shot is necessary, but certainly the pharmaceutical companies have already started to develop those shots. If that is the case, if it turns out that we need a booster shot, would we need to get the same booster shot as the initial vaccine that we got? Like, I got Pfizer, so does that mean a Pfizer booster shot?
I don't think so. Now, I'm just speaking from my personal standpoint here. I think once your adaptive immune system, that means the antibody making part of your immune system, the memory part, the recognition part, and the cellular part of your immune system has seen the virus or has seen the vaccine, you can get a different vaccine, a different antigen. That's the foreign substance, the particles of the virus, and you will mount a booster immune response. Now, I don't know if that immune response is going to be necessary right away. It may take a year, may take 2 years. We're studying that now. We don't know how long your immune system persists in being robust and combating infection at this time. However, we do know that your immune recognition is in your body for many, many years. And it may be that these vaccines are so potent, the ones that we've already received, that you're good for at least 1 to maybe 2 or even possibly 3 years without getting a booster. And that's good news.
So, as you know, Memorial Day weekend is about to start. It is the unofficial start of summer for many people, and there are a lot of families that have taken to the airways and roadways. I'm wondering if you have any advice for travelers, particularly those who are flying, because this is also the time of year that a lot of people fly with their families, children under the age of 12 who are not, who do not have access to the vaccine. So, any advice for them?
Yeah, my advice is to wear a mask on airplanes because, you know, airplanes, buses, or trains, because you don't know who you're sitting next to. And people get common colds. This is a very high pollen season, so there's people out there sneezing and coughing all over the place. And you simply don't know who is and who is not infected. And as I mentioned, we think now that the infection that are asymptomatic could be 3 to 20 times greater than we originally thought. So if you're traveling, protect yourself. It won't hurt. The travel time, even across the country, is not that long, so that it can't be that uncomfortable to wear a mask, wash your hands, and wipe things down in your seat. Now, once you get to your barbecue or your family event, you can drop your masks, or you're all vaccinated. The little ones will be protected because, remember, the infectivity of children, at least symptomatic infectivity, is exceedingly, exceedingly low. So with little children below the age of 12, I wouldn't worry too much about it, but I would worry about adults, young adults in particular, and just try to be extra careful. Common sense.
Yeah. Right. You should always be a little extra careful out there. Dr. Bob Lahita, thank you so much.
Thanks, Anne-Marie.